This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
And good morning. Welcome to Mod Health Talk, and we are live for this Memorial Day. A live show on this Monday morning. Thanks for joining us on 104.5 FM, 1440 AM WHAR. I'm Kyle Wiggs sitting in for Dave Wilson, who does have Memorial Day off. He'll be back tomorrow, and he'll be back with Mod Health Talk coming up next Monday. Our guest this morning is Dr. William McBee. And Dr. McBee, good morning. Thanks for coming on. We appreciate your time this morning.
Yeah, good morning. Thanks for having me.
All right. May is Women's Health Month, and we're wrapping up Women's Health Month. So let's start by talking about your specialty. What are the things that that you bring to the Mon Health system?
So I'm a gynecologic oncologist. So I take care of women with GYN malignancies, including ovarian cancer, uterine cancer, cervical cancer, vulvar cancer.
Okay. You've been on this show many times before, but let's remind our listeners where you're from and where you were educated.
So, yeah, I grew up in Morgantown. I went to Morgantown High School, and then I went to WVU for undergrad and medical school. And then I did a residency at it's Case Western program. At the time, the program no longer exists, but it was a split time between Metro Health Medical Center in Cleveland and Cleveland Clinic. They now since each have their own programs. And then I did fellowship at McBee at UPMC, and then finished fellowship in 2010, and then came back to Morgantown in 2010.
Okay, so your specialty is women's health, and again, gynecologic oncologist. Is this a situation that is getting worse? Do you see more instances of women suffering from these cancers, or has early detection helped eliminate some of these problems before they begin?
So the most common GYN malignancy we deal with is uterine cancer, and we fortunately we are able to detect it early because it usually presents with symptoms early on. Unfortunately, the driving factor for most uterine cancer, not all, but most, is obesity, and as you know, as a country and as a world, we're getting heavier. So so the numbers are going up, but we do typically find that cancer early on. Some of the other cancers, we don't really have a great early detection tool for ovarian cancer. Cervical cancer, I think we are making some good strides, especially with HPV vaccine. And now that it's been several years since it's been around, we're starting to see maybe some decline in cervical cancers. Okay, you mentioned some of the early symptoms. What would those be? So with uterine cancer, or the most common type of uterine cancer is endometrial cancer, which is cancer of the lining of the uterus. The most common presenting sign is bleeding. Sometimes some abnormal discharge, but oftentimes bleeding. The cervical cancer, also the presenting sign is usually bleeding, but hopefully people are getting yearly exams by their gynecologist, and we detect there's a precancer lesion for cervical cancer, so hopefully we're detecting that, and that actually can be found early and can be prevented with yearly follow-ups. Ovarian cancer, unfortunately, does oftentimes present as later stages, and and a lot of times the presenting signs are nausea, vomiting, bloating, and again, unfortunately, usually the cancer's advanced at that point. Okay, you mentioned the yearly exams in terms of preventative treatment. What percentage do you think of adult women have access to these yearly exams, and how many follow through with that, do you think? I honestly don't know those numbers. I mean, I think that the access, especially in our area, is high. I think, between, Mon Health and WVU and, and a variety of independent providers, I think that certainly in our area, there's plenty of access. As far as, what percentage of adult women receive an annual GYN, I don't know that number. Okay. What age do you recommend
that young women start to get these annual exams?
So I think that they should go to see their pediatrician, until they turn 18, and then at some point, then around age 18, they should probably start seeing a gynecologist. Doesn't necessarily mean that they're going to need any exams or anything that's embarrassing or uncomfortable at that age. But I think at that age they should at least start forming a relationship with a gynecologist that they trust, and then the gynecologist will kind of know when the woman needs certain things.
Okay, and I would imagine there are some risk factors. You mentioned obesity, so diet's a big factor. How much does smoking play a part in some of these cancer that women face?
Certainly increases risk of cervical cancer. Probably not, and maybe some vulvar cancer, cervical and vulvar cancer, which is but I don't know. Probably not so much as in some of the other types of GYN cancers.
Okay, but it's never good to smoke. It's all every doctor.
There's plenty of other diseases. I mean,
right.
And the biggest thing obviously is cardiovascular disease. I mean, so there's obviously but it's obviously good not to smoke.
Every doctor we've ever had on this show, the first thing they say is you become healthier the day you stop smoking. So that's certainly one thing to avoid. All right, some of the procedures and surgeries that perhaps if you're diagnosed, hopefully if you do get one of these diagnoses, it's early, it's treatable. What are those types of procedures that help to eliminate a problem once that you're diagnosed?
Well, so for uterine cancer, the procedure is typically a hysterectomy with staging. So staging just refers to taking some additional biopsies, whether it be lymph nodes or otherwise, to be sure that the cancer hasn't spread. So then you can adequately stage the cancer, and additional treatments are based on the stage of the cancer. So sometimes patients, in addition to surgery, will need chemotherapy and or radiation. So that's why it's important that they have the appropriate staging. We do all those minimally invasive, laparoscopically or robotically. The cervical cancer is similar. There's a few nuances with cervical cancer where actually the standard of care is actually to do those through a kind of more traditional type of incision. But at the end of the day, it's still a hysterectomy. It's a little bit different type of hysterectomy. And staging. Oftentimes with cervical cancer, the primary treatment is actually chemo and radiation, which we also offer at Mon Health. Ovarian usually just depends on whether it's taking out an ovary or doing a much bigger surgery if the cancer spread inside the abdomen. But certainly surgery is the mainstay treatment for that as well. And then oftentimes with ovarian cancer, patients will need chemotherapy after. And vulvar cancer also removing the abnormal skin lesion and then taking some lymph nodes to be sure nothing is spread.
In my mind, one of the more remarkable medical innovations of the last 10 years are these minimally invasive surgical offerings that you have. I mean, it seems to me that the technology just in the last few years has increased exponentially to where these are, they're not situations where you spend multiple days in the hospital most of the time. Can you discuss that and how this has aided your job the last few years?
Oh yeah, it's much different. To give you an example, when I was in Pittsburgh, I had 7 different attendings, which is a lot of the GYN oncologist. And at the time, I was there between 2007 and 2010, and I mean it's pretty much state of the art facility. So it wasn't like they were behind the times. But at the time, there were about half of the attendings were doing things through an open incision, and half the time they were doing it minimally invasive. And so in the past 12 years, really the standard of care is minimally invasive. I mean, there's very, very few instances where anybody should have a big incision on their abdomen for a hysterectomy. And it's completely replaced minimally invasive surgery. Again, whether it be robotically or laparoscopically, completely replaced an open incision for GYN, whether it be benign GYN surgery or GYN cancer surgery. And as far as it's done, as far as stays in the hospital, I mean, significantly reduced that. I mean, we typically may only have like 1 or 2 patients in the hospital, at any given time where, like I said, when I was in Pittsburgh, we used to round on 20 or 30 every morning. So it's very different. We send everybody home the same day for the most part. There's a few occasions where people will have to spend the night or two, but 95% of everybody goes home the same day of the surgery.
That's incredible. It really is incredible. And I know there's people listening who have had this procedure 15, 20 years ago, and they think, my goodness, I was in the hospital for a week. But the fact that people go in for a procedure like a hysterectomy and can walk out later that day is incredible.
Well, not only not only the recovery is different, it's the risk of complications a lot different. So like you said, you're right, may stay in the hospital for a week, but then their risk of complications are way, way higher. So then a lot of times they have to stay additional days just to overcome the, complications from surgery.
All right, before we take our first break here, what symptoms should people not overlook? Or if you have these symptoms, obviously you do not want to delay care when it comes to your gynecological concerns. What should the person out there be looking for?
I mean, I think the first thing is to establish care with a gynecologist that you trust. And I say gynecologist, but there's a lot of family doctors that do GYN care too, and that's completely fine. You don't have to necessarily have a separate gynecologist, but a lot of people do. But I think anything abnormal. I mean, so if you're premenopausal, any change to your menstrual cycle or any bleeding between periods. Once you're postmenopausal, any bleeding at all, anything that just doesn't feel right, you feel like your abdomen's fuller, you feel like, when you start to eat, you get full quickly, certainly nausea, vomiting. And then as far as the vulvar cancer, a lot of times it's surprising, but a lot of times those are delayed diagnoses because, providers, sometimes the patient's just trying to chalk up symptoms to like a yeast infection or a little bit of itching, but a lot of times those can be found too just with routine exams. And if you notice something different, seek out medical care.
All right. We are with Dr. William McBee, Gynecologic Oncologist with Mon Health Systems. This is Mon Health Talk Radio. We will continue the conversation. Stay with us. We'll take a break. 104.5 FM, 1440 AM, WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Monday, the Memorial Day holiday, and we appreciate you joining us on WAJR, and we appreciate the time of Dr. William McBee, Gynecologic Oncologist with the Mon Health Systems. And Doctor, welcome back. Again, thank you for joining us this morning.
Yeah, thank you. Thank you for having me.
Let's talk about non-surgical treatments. What advanced treatments are available non-surgery for women that face the diagnosis that we've talked about in that first segment?
So we'll start with ovarian cancer. I mean, I think that there certainly are women that are advanced age to get diagnosed with ovarian cancer, or women really of any age that essentially have cancer in locations that won't respond to surgery. And the easiest example is cancer. Sometimes it spreads to the lungs. We don't necessarily do upfront surgery on those patients, so oftentimes we'll treat those cancers with chemotherapy, and fortunately they do actually respond really well. Sometimes that's the only treatment they end up getting. Again, if you have somebody, just in this example, who's 90 years old and has other medical problems, sometimes you can or cannot give that patient chemo, but it's oftentimes easier to give them chemotherapy than it is surgery. So a patient like in that scenario, they may have chemotherapy as their only treatment. The other thing that comes to mind is cervical cancer, certainly in women that either have advanced cervical cancer, which the standard of care is chemo and radiation, or to be honest with you, you could treat somebody with an early stage cervical cancer and have similar outcomes with radiation as you do for surgery. So if somebody wanted to avoid surgery, then that would be an option. Now, that all being said, that's not necessarily the best option, because a lot of times there's other side effects. It's not that radiation's without side effects. And then also patients with endometrial cancer, it's less common to treat somebody with endometrial cancer, but we do have hormonal options to treat patients with endometrial cancer that want to avoid surgery, and sometimes radiation.
Okay, so again, no treatment is completely devoid of side effects, right? These non-surgical procedures have side effects as well.
Well, yeah, but non-treatment, it's devoid of treatment side effects, but certainly there's side effects to go along with the cancer. So, you're trading one for the other.
Mm-hmm. Okay, so when would you suggest a patient comes to see you? When is a situation enough to pick up the phone and call you and make an appointment and come in?
Most of the patients that I see come from referrals, either from their OBGYN or a family doctor. But that being said, sometimes patients are receiving cancer treatments elsewhere, and they just want to refer themselves for either another opinion or to transfer care, and that's certainly fine. Also, I see patients that are self-referrals that don't necessarily go through. If they don't have a gynecologist or a family doctor, I'm more than happy to see patients so they certainly could call our office, and I would be happy to see them. But again, the majority of the patients, probably 90+%, are referred. Usually they see their gynecologist first or their family doctor first, and then an issue is identified and they get referred. But I'm happy to see patients who don't go that route.
Mm-hmm. Okay, what's the best way to reach out to Mon Health Systems and your line of specialty specifically?
My office number is 304-285-3870. Again, 304-285-3870, and they could call the office, and I'd be happy to see them.
All right. Again, May is Women's Health Month, and kind of an emphasis on educating people on what they need to do and what they need to look for. But obviously, you recommend 12 months of the year. Good health for women, certainly, and from all patients. Go ahead.
Yeah, and things we didn't bring up, from other than just GYN cancer stuff is, usually, gynecologists will keep you up to date on mammograms, colon cancer screening. I mean, so there's a lot more that goes into it than just, trying to identify a GYN cancer early. A lot of times it's just, good health things, trying to maintain a good weight, not smoking, losing weight if you're obese, some exercise. So it's more seeing a doctor every year, whether it's a gynecologist or not. I mean, it's more goes into it than just trying to detect a cancer early.
Yeah, absolutely. All right, Dr. McBee, great information. We appreciate your time, certainly, on this holiday. Thank you for joining us. And again, May is Women's Health Month, and we're glad that we could provide this information for you, helping women to learn more about cancers that may affect them in their lifetime. Dr. McBee, again, thanks, and enjoy your day today, and we'll talk to you again.
Okay, sounds good. Thank you.
Dr. William McBee, Gynecologic Oncologist with the Mon Health System. He's been our guest this morning on Mon Health Talk, and we appreciate his time. We appreciate you for joining us this morning on this holiday, and hoping everybody has a Memorial Day. Keep in mind what this holiday is all about, to honor those who have fallen in defense of this country.